Hello, and welcome. Today we'll be exploring a complex and often challenging condition known as amyloid neuropathy. This video will break down what it is, what causes it, how it's diagnosed, and the latest advancements in treatment. Whether you're a medical professional, a patient, or simply curious, we hope this provides valuable insight into amyloid neuropathy. So, what causes amyloid neuropathy? The root cause lies in the buildup of abnormal protein deposits called amyloid fibrils. These fibrils accumulate in various organs and tissues, including the nerves. There are several types of amyloid proteins that can cause neuropathy. The most common inherited form is caused by mutations in the transthyretin or TTR gene. This genetic mutation leads to the production of unstable TTR protein that is more prone to misfolding and aggregating into amyloid. Other forms can be acquired, such as light chain amyloidosis, where amyloid is formed from fragments of abnormal antibodies produced by plasma cells. Sometimes, amyloid neuropathy can be associated with chronic inflammatory conditions. Let's delve into the pathophysiology. Amyloid fibrils, once deposited in and around the nerves, disrupt their normal function. They physically compress the nerve fibers, impede the transmission of nerve signals, and even trigger an inflammatory response. This disruption leads to nerve damage, particularly affecting the peripheral nerves, which are responsible for transmitting signals between the brain and spinal cord and the rest of the body. The specific symptoms and severity depend on which nerves are affected and the extent of the amyloid deposition. Now let's consider the epidemiology. Amyloid neuropathy is considered a rare disease, but its exact prevalence is difficult to determine because it's often misdiagnosed or underdiagnosed. TTR-related amyloid neuropathy is more common in certain geographic regions, particularly Portugal, Sweden, and Japan, where specific genetic mutations are more prevalent. The acquired forms can occur in individuals with underlying conditions that increase their risk of amyloid formation. The age of onset varies depending on the type of amyloidosis, with inherited forms often presenting earlier in life than acquired forms. What are the signs and symptoms? Amyloid neuropathy manifests with a wide range of symptoms, often affecting sensory, motor, and autonomic nerve function. Patients commonly experience numbness, tingling, and pain in their hands and feet, often described as a burning sensation. This sensory loss can progress upwards. Motor symptoms can include muscle weakness, difficulty walking, and impaired coordination. Autonomic dysfunction can cause problems with blood pressure regulation, leading to dizziness or lightheadedness, as well as gastrointestinal issues like diarrhea or constipation, bladder control problems, and erectile dysfunction in men. Because these symptoms can mimic other conditions, early diagnosis is crucial. How is amyloid neuropathy diagnosed? The diagnostic process typically involves a combination of clinical evaluation, nerve conduction studies, and tissue biopsies. Nerve conduction studies assess the function of the nerves and can detect abnormalities indicative of nerve damage. A biopsy, usually of the nerve or fat pad, is essential to confirm the presence of amyloid deposits. The amyloid deposits are then stained and examined under a microscope to identify the specific type of amyloid protein involved. Genetic testing can be used to identify mutations in the TTR gene in suspected cases of hereditary amyloidosis. Cardiac or other organ involvement is usually assessed with further testing like echocardiograms, cardiac MRI, or nuclear imaging studies. While there aren't strictly distinct classifications in the same way as some other neurological diseases, we can categorize amyloid neuropathy based on the type of amyloid protein involved. The most relevant distinction is between hereditary TTR amyloid neuropathy, also known as familial amyloid polyneuropathy or FAP, and acquired forms of amyloid neuropathy such as light chain amyloidosis AL. Localized forms also exist, though they are less common. The treatment and management of amyloid neuropathy focus on slowing disease progression, managing symptoms, and improving quality of life. For TTR-related amyloid neuropathy, TTR stabilizers, such as tafamidis, can help prevent the TTR protein from misfolding and forming amyloid deposits. Gene silencing therapies, such as patisiran and anodersen, reduce the production of TTR protein in the liver. Liver transplantation can be considered in some cases to remove the source of the abnormal TTR protein. For AL amyloidosis, chemotherapy or stem cell transplantation may be used to target the plasma cells producing the abnormal light chains. Symptomatic treatment includes pain medications, physical therapy, and supportive measures to manage autonomic dysfunction. Currently, there's no definitive way to prevent inherited forms of amyloid neuropathy. Genetic counseling is crucial for individuals with a family history of the disease. For acquired forms, managing underlying conditions that increase the risk of amyloid formation, such as chronic inflammatory diseases, may help reduce the risk. Early diagnosis and treatment of these underlying conditions are essential. Research into potential preventative measures is ongoing. The prognosis for amyloid neuropathy varies depending on the type of amyloidosis, the extent of organ involvement, and the individual's response to treatment. Early diagnosis and prompt treatment are associated with better outcomes. Recent research has focused on developing new therapies to target amyloid formation and improve symptom management. Clinical trials are ongoing to evaluate the safety and efficacy of novel drugs and treatment strategies. Continued research holds promise for improving the prognosis and quality of life for individuals with amyloid neuropathy.